Hi, and welcome to the informational video webinar series on the rules for certified school-age childcare centers. This is video number 2 on the certification process, center capacity, and definitions. Hi, my name is Christina Christian. I work for the Office of Childcare as a regional manager in the Tualatin Field Office. This is the second video as part of an introductory video series on basic information about the new school-age childcare rules. During each video in the series, we will explain some of the key features of the school-age center rules. The rules have been organized differently to help make information easier to find. We hope that you enjoy these videos and find them helpful in learning about the new certified school-age childcare rules. The certification process. The license is good for 1 year. Visits are conducted as needed for the purposes of determining compliance with the rules, terms, and conditions of the certification. An unannounced monitoring visit is conducted at least once during each license period. There is at least one announced visit each year for the purpose of your license renewal. Let's talk a little bit more about the different types of visits. Announced visits are visits that we schedule in advance with you. There are 3 main types of announced visits: pre-certification visits, initial and/or renewal licensing inspections, and technical assistance and consultation visits. Primarily, announced visits are conducted at your request for the following reasons: to become licensed or renew your license, to request technical assistance regarding compliance with the rules, or to request a consultation for supporting your program with requests for changes to your license and/or quality improvements to your program. Unannounced visits are not scheduled in advance. There are 3 main types of unannounced visits: monitoring visits, compliance verification visits, and complaint visits. Unannounced visits are conducted for the purpose of determining compliance with the rules and terms and condition of the certification. Let's talk more specifically about some of these visits. Monitoring visits. Typically, your licensing specialist will conduct your monitoring visit. The licensing specialist will review the child care space or spaces and outdoor spaces. Non-child care spaces are reviewed as needed. Complaint visits. A complaint visit occurs when the Office of Child Care receives an allegation of an alleged rule violation. Typically, an investigative specialist will conduct this type of visit. It can also be conducted by a licensing specialist. Depending on the allegation or allegations, the Office of Child Care will review child care spaces, non-child care spaces, outdoor spaces, review records, review policies, and interview program staff and/or families as needed. Certain complaint visits are done with partner agencies when the complaint involves an allegation of child abuse. Compliance verification visit. A compliance verification visit is conducted as a follow-up visit to a valid noncompliance finding or findings. The visit is to ensure that a program has made the necessary corrections to ensure ongoing compliance with the rules, terms, and conditions of their license. Depending on the finding or findings from a previous visit, the Office of Child Care will review child care spaces, non-child care spaces, outdoor spaces, and/or review records as needed to determine compliance. A pre-certification visit. When you are planning to open a new program, you will request a pre-certification visit from the Office of Child Care. At the visit, we will review the entire space, including the indoor child care spaces, outdoor spaces, and any non-child care spaces. The Office of Child Care will measure child care spaces and outdoor spaces for potential capacity and review the steps to licensure and the rules with you as well. Initial and renewal visits. Initial visits are conducted after the Office of Child Care has received your application for licensure and it has been processed and assigned to a licensing specialist. Renewal visits are conducted after the Office of Child Care has received your application for renewal of your license and once it has been processed and assigned to a licensing specialist. Prior to conducting initial visits and renewal visits, you must obtain approval from an environmental health specialist and an approved fire inspection must have been conducted within the last 2 years. Technical assistance and consultation visits. Technical assistance visits, or TA visits, can be requested by the program or at the request of the Office of Child Care. TA visits are meant to support programs with maintaining compliance with the rules. Consultation visits are typically requested by the program or in collaboration with your local child care resource and referral agency. Consultation visits focus on supporting programs with quality improvements to their program. Ready to apply or time to review? Just like other types of licensed care, the school-age certified centers must do the following: submit a complete application to the Office of Child Care, obtain approval from the environmental health specialist, conduct lead testing of each water source at least every 6 years, successfully complete the Office of Child Care's health and safety inspection, provide evidence that the center meets all applicable building codes and zoning requirements, unless operating in a public school building. Have written approval by a state or a local fire code official within the last 2 years of the renewal date. Center capacity. Center capacity is determined by measuring your indoor child care space and the number of available toilets and sinks. Indoor space must have a minimum of 35 square feet of activity space per child. Outdoor space must be no less than 75 square feet per child. There must be one toilet available for every 15 children. There must be one hand washing sink for every 2 toilets. The Office of Child Care will provide a potential capacity during the pre-certification visit, but a final determination will be made at the initial visit for licensure. Center capacity. You must have the Office of Child Care approval prior to using a new room, activity area, or outdoor space to care for children. You may only care for children in activity areas approved by the Office of Child Care. You must not exceed your license capacity at any time, including the total number of children in care both at and away from the center. Certified School-Age Child Care Center rules, definitions. Most of the definitions in the Certified School-Age rule set are the same or very similar to center child care rules. Some of the definitions have been revised, written in plain language, and added for clarity. Here is an example of similar definitions. In the rules for a certified child care center, guidance and discipline is defined as the ongoing process of helping children develop self-control and assume responsibility for their own acts. This definition is slightly updated, but still similar under the Certified School Age Center rules. It is now titled Behavior and Guidance, and the definition means the ongoing process of helping children develop self-control and assume responsibility for their own behaviors and actions. Examples of revised and newly added definitions. Developmentally appropriate is defined as a caregiver interacts with each child in a way that recognizes and respects the child's chronological and developmental age, knowledge about how children grow and learn, the developmental level of the individual child, and interactions and activities are planned with the developmental needs of the individual child in mind. Field trip is defined as an excursion or program activity with a specific destination away from the center that begins when staff and children leave the center's property, whether by vehicle or by walking. It does not include neighborhood walks, routine school or home pickup and drop-offs provided by the center. Examples of revised and newly added definitions. Hazards are defined as anything that may inflict injury or cause harm. Technical assistance is defined as consultation and advice given to providers to assist them in maintaining compliance. Be sure to read the definition section of the rule book. If you find any terms in the rules that you are not sure about, please refer to the definitions section in the rules. If you are still unsure, contact your licensing specialist or another member of your licensing team to support you. Thank you for watching. You can now move on to video 3 in the series.